I ended up discovering a really foundational piece of how the human brain develops and some things that might put babies at risk unintentionally. Something that pregnant people might not know is actually dangerous. When a baby's brain is forming, it forms from these stem cells. A stem cell is a cell that become different types of cells. And there's a type of cell in the brain, it's a progenitor cell, that can become different types of neurons, but also different types of supporting cells in the brain. She studied how they know who to become. And it's very complicated. There's some signals that come from outside of the cells through cerebrospinal fluid from your brain. And she studied how those signals get there during embryonic development. There's a little tissue that spits out instructions at the stem cell. And this tissue is what I also studied. It's called the choroid plexus. It's very important. If you mess up the instructions it spits out, the brain does not form right. But we didn't really know what told it what to spit out or really how it spits it out. So I ended up discovering a type of spitting out way or a form of exocytosis. I found a way that these cells physically form what looks like a water balloon full of signals, and the water balloon releases these signals that the stem cells receive. I found that one of the things that make these cells form a water balloon is when a serotonin receptor is activated, specifically one type of serotonin receptor called 5-HT2C, which is the only serotonin receptor these cells have at all. And during early embryonic development, they're the only cells in the brain that have it. Well, like, who cares and why does this matter to people? Why should you care about this? And there's a whole lot of things that can mess serotonin during pregnancy. But specifically, I was curious about medications that are made to target that receptor. There's a few on the market that are only for that receptor. There's some in clinical trials for epilepsy and schizophrenia. There's one that used to be on the market for weight loss, but is no longer on the market. But then what ended up being super cool about my work is that there's a whole nother family of molecules that really highly activates 5-HT2C. My boss will be presenting my work at conferences, and one day she emails me, and the subject line is just psychedelics ? And I was like, what? She's like, yeah, I've been sharing your work at conferences, and people keep asking me if psychedelics would do this or activate this system. And I was like, oh, I had never connected those dots. Most serotonergic psychedelics highly activate 5-HT2C. A lot of the research on that's not the receptor that's primarily focused on, because there's such exciting things being found about 5-HT2A, but they certainly do activate that a lot. I have been working with these other chemicals that activate this receptor for years. When we use a specific drug from a chemical company that activates only this receptor, bad stuff happens to the mouse babies when the mom gets this. LSD does activate this system too. So we've done a lot of work since where we've investigated the effects of prenatal exposure to LSD on brain development. And I will just say the takeaway that please don't take acid if you're pregnant. Psychedelics have a tremendous amount of promise for so many things, but from our work and the work of others like David Olson, also don't take it if you're breastfeeding. LSD as a compound is really good at getting through stuff. So it'll go through the placenta straight into that embryo. We know now that it is going to impact brain development, but it probably impacts other parts of the organism's development too. We haven't even characterized that yet. And some of David's work is starting to show that if you're breastfeeding and you take LSD, it's also going to go right into that breast milk with negative consequences. And so just something to be aware of as the psychedelic field matures and more excitement and momentum is put behind them for therapies that they are really effective, is that maybe we need to develop ones that don't cross the placenta or figure out how to protect developing embryos from these unanticipated negative consequences of something that might be really transformative for the pregnant person.